The next product I'm going to introduce you to is our Pain Relief Max. It's a foot cream that was specifically designed to address painful conditions of the foot that did not respond to any of the other topical treatments. I found this especially useful in neuropathic patients. There's several treatments out there on the market that claim to treat neuropathy. This is a common pathology often associated with diabetes, but it can be caused from many different things. This particular cream is all natural, as all our products are. It contains several active analgesics, among them clove oil, corydalis, and frankincense, or boswellia, as you probably commonly know it. We combine these in a hemp seed oil base along with emu oil to maximize the penetration and the lasting effect of the cream. It's easy to apply. For instance, diabetics who often have trouble initiating sleep because of the pain in their feet apply a finger-width band around the ankles near bedtime. This allows them to go to sleep and get their rest. It's useful in sprained ankles, tendonitis, any kind of swelling or bruising. Patients with Patients with fibromyalgia even find this cream useful, and a useful adjunct to their other treatments. I'm going to show you how to apply this for the neuropathy patients, but again, it has a myriad of uses. So here's a jar of the Pain Relief Max cream. I'm going to apply it as I would again to this person's ankles in the fashion that you would use for it to be most effective against neuropathy pain. So you just take a small amount. Again, you're just painting a finger-width band. Start at the Achilles, come around the dorsum of the foot and back underneath the lateral malleolus around the Achilles. You're just going to do that on each of the patient's feet. Again, nighttime is the most important, but I often have these patients do this morning and evening. The reason for that is there's a cumulative effect. You want to be sure and rub it in good around the posterior tibial nerve. Patients that use this twice a day report a much greater benefit in the long run, and I've had patients report after a month's use that the feeling or sensation was returning to normal in their feet. Now, I don't expect that to happen with every person that uses this, but I think the reason it does in those particular patients is the reason the patient had neuropathy to begin with. In this particular patient subset, they were all diabetics. They had some ischemia, and this cream actually has some vasodilatory effects, and I think that helped restore the blood flow to some of the major nerves. Is why they regained some of the sensation. But that's how you apply this, and it's easy. A finger-width band doesn't take much. Once a day is good, twice a day is great. And that's how I use that for diabetic neuropathy.